It is Wellness Wednesday here on Good Morning Mid-Michigan. Today we are talking about something that impacts a lot of people, headaches. In this sponsor segment, we welcome Dr. Wade Cooper, a neurologist who specializes in headache medicine at Memorial Healthcare Institute for Neuroscience. Good morning.
Hi, Matt. Thanks for having me here today.
Yes, thanks for your time and your expertise. Let's start with, first off, what is headache medicine?
I'm so glad you asked that question. We know that headache affects a whole lot of people. We know about 1 in 4 women aged 20 to 45. We know about 1 in 10 men aged 20 to 45 have migraine. And migraine is the #1 leading cause of disability for people under age 50, taking time from work, from family, and from fun events. And we just don't think that's fair. So people who do headache medicine are a band of providers trying to find solutions for people who are impacted by chronic headache.
Yeah, interesting stats there. We'll dive into that a little bit more then. What are some of the top challenges that people with migraines or headache syndromes encounter?
Well, some of the most unfair things about headache and migraine is there's a tremendous amount of stigma attached to this. That means that if someone has migraine, which is a neurologic disorder, taking time away from their family and their work, sometimes other people don't appreciate what that means. Sometimes their coworkers think they're not being tough. Sometimes people think it's all in their head, and that's really just not fair.
And then why are you so passionate then about finding those answers?
Oh, well, that's the best part about this. So in my line of work, we get to find solutions to help people improve their quality of life. There's been a tremendous amount of breakthroughs that have led us to very effective treatments that can lower frequency of headache, lower intensity of headache, and help people get back to what's most important for them.
We'll talk a little bit more about those newer breakthroughs. What's looking promising right now?
Well, that's the best part. So before 2018, there was all of this work of using treatments for migraine that just weren't specific to help turn off migraine signals. But since 2018, there's been an identification of an inflammatory marker that essentially irritates the lining of the brain, activating pain receptors, but also turning on the volume for incoming signals like smell and sound, and bothering people's ability to sensation of all this feelings coming in. And we know now that this inflammatory protein can be blocked by very specific therapies that have very minimal side effects and really start reducing frequency and intensity of headache.
Interesting. Glad to see, that research has resulted in promising results with treatment. Let's talk about your new location in Howell.
So Memorial Healthcare just opened up a Howell location. They've been thriving in the neurosciences, especially with their headache group in their Okemos location and their Owosso location. But we just opened up in Howell to better serve the people of mid-Michigan, providing headache services, but also general neurology there for things such as epilepsy and peripheral nerve disorders.
So another option there to get the help that you need. Overall, for folks who do suffer from headaches or even migraines, what is your message to them watching? I'm sure you have their attention today.
Well, thank you very much. So the thing I'd want to say is if you know somebody who is taking time away from their life with headache, including light and sound sensitivity, nausea, and of course the pain part, there's treatments out there. We also know if you yourself are having recurrent bouts of headache that take time away from your family, from your work, it's time to get help, and that time is now.
Yeah, again, encouraging news, though, to hear about the advancements in treatment and all the work you do to help people. For more information from our Wellness Wednesday segment today and Memorial Healthcare's Institute for Neuroscience, you can go to the website that you see there on your screen or call that number as well. Thank you so much for your time and insight. We appreciate it.
Thank you for having me, Matt.